I'm gonna go for 8. I'm gonna stand up and say hi. My notes are on my laptop because my printer broke, so I'm gonna have to sit down to read, so apologies. I'll say hi again later. Okay, so thanks for inviting me. I'm in part really honoured, and in part just a little bit in awe of being here with Sonia and Reem. So you mentioned time to think in the introduction, but my focus today won't be on the past, but on where we are now and the future. Because I think we are at a crucial point in time when it comes to how we as a country help our gender questioning children. As I'm sure most of you know, the Cass Review came out this year. For anyone who isn't familiar with it, this was a landmark independent review commissioned by NHS England. They asked Dr. Cass to review the existing gender services for children and to make recommendations about what type of care these children should receive moving forwards.
Can you put the microphone?
Sorry, can you not? Okay, sorry. Care that meets their needs is safe, holistic and effective. She published her findings in April. And some of her findings were unequivocal. Cass confirmed with empirical evidence things that we already knew. Over the past 10 to 15 years, we've seen an unprecedented and unexplained increase in young people identifying as transgender and questioning their gender. At the same time, we've seen an unexplained change in the demographics of this group of kids. It's changed from being predominantly natal male with lifelong gender-related distress to being predominantly, upwards of 70% now, natal females, with many with a later onset of distress. And we know now for sure that as a group, these young people are more likely to be what we clinicians call complex. They are more likely to have comorbid mental health problems, to be same-sex attracted, to be on the autistic spectrum, or to have experienced negative life events such as abuse and trauma than other young people. The Cass Review also describes how, across a similar time period, we have seen the introduction of a novel approach for managing gender-related distress in our young people. The medical affirmative model, broadly, involves affirming a young person's felt identity, offering puberty blockers from the brink of puberty, followed by cross-sex hormones in later adolescence, and then the options of surgeries in adulthood. The gender affirmative model then is a very significant intervention with the potential for profound, lifelong, wanted and unwanted physical changes. So, Cass independently commissioned the University of York to look at the evidence for this new treatment. And in response to the 7 systematic reviews that they conducted for her, she concluded that the evidence base for this significant intervention is remarkably weak. As a result, the then government placed a temporary ban on puberty blockers, which Wes Streeting made permanent when he came into office. Well done, Wes. Instead, Cass recommends holistic, individualised and a predominantly psychosocial therapeutic approach for supporting gender-questioning kids. Something I agree is necessary in order to meet the wildly different needs present in this group. To give you a flavour of the diversity of this work, I want to talk you through an imaginary therapy clinic. We psychologists love a role play. So imagine now, if we're honest, 90% of our doctorate is role play. So imagine now, if you will, that you are the therapist. When I do this, I like to channel Dr. Orna from couples therapy, but get into role however you choose. So you're in your clinic. Your first patient might be a 15-year-old girl who transitioned to live as male in an all-girls school just last month. They tell you that this is going really well so far. They feel understood and seen for the first time ever, and they've just started dating the girl who wouldn't even look at them before. This adolescent wants to know from you how to access puberty blockers, now that bad Hilary Cass has had them banned. Your second client today might be a young, highly functioning trans man who has been taking testosterone via a private clinic for several years. He might say to you, I'm not here to question my identity, but I do need somebody I can trust to help me to decide whether to have surgery or not. Next up in your clinic today is a detransitioned woman in her early 20s who could ask you tearfully, and not for the first time, why did no one tell me I might ever get this wrong? Why did no one ever even question me? And finally, a teenager with a crippling history of trauma and OCD might ask you, am I gay? Am I trans? These questions are driving me mad. Gender questioning and trans-identified young people are not one group, and to treat them as if they are is risky. For some young people, their gender identity feels like a cherished and essential part of themselves that is beyond question. For others, it is something they try on, sometimes fleetingly, as part of a normal process of identity exploration. And as Cass points out, when we professionals meet them, we can't tell, in fact nobody can tell, whose gender identity will persist and whose will not. And that is why I think that the Cass Review was right to recommend extreme caution around any irreversible medical pathway. So far, so good. Then, in the King's Speech background briefing on the 17th of July 2024, the Labour government committed to its draft bill to deliver on their manifesto commitment. The manifesto says, Labour will finally deliver a full trans-inclusive ban on conversion practices, whilst protecting the freedom for people to explore their sexual orientation and gender identity. And what could possibly be wrong with that? I mean, what right-minded person wouldn't want to ban conversion practices? But the devil here is in the detail. Firstly, let's get real. Conversion and aversion practices were once practiced by therapists in the NHS with same-sex attracted adults. These practices were often punishing and included horrors such as electric shock treatment and induced vomiting. There is no evidence that this is happening today, and certainly not with children, because that would be illegal. But it did happen, and in my opinion, we mustn't minimise the suffering of this previous generation of gay adults by appropriating their experiences and misapplying them to a new generation of gender-questioning children. Bear with me. Because that is what is happening. Some people who call themselves trans allies argue that the individualised and holistic therapeutic approach that Cass is recommending is conversion therapy. They are arguing that these children have a right to medical affirmation and treatments, regardless of the gaps in the evidence base or the risks, and that to offer anything else is equivalent to the crimes committed against gay adults in the past. Every clinician I know who works in a responsible, Cass-aligned way has already been called a conversion therapist. Wes Streeting has been called a conversion therapist. It's absurd. As far as I'm aware, he's not even a therapist. I mean, you never know, side hustle.
He's very talented.
He's a bright boy. But it worries me. If these malicious accusations are already being made, what will happen once this passes into law? Some clinicians already seem to be more afraid of being called a conversion therapist than of offering unevidenced medical treatments to children. And the biggest risk here, as Cass says, is that good professionals might avoid working with gender-questioning children altogether at a time when we need them most, which would be a tragedy. Secondly, the manifesto speaks about trans people as if we all know exactly what that means, as if that is one easily defined group of people, and as if the membership of that group doesn't change. But trans, Stonewall tells us, is an umbrella term that can include binary and non-binary people and the gender fluid. People, especially young people, can and do move between identity categories. And assuming that anything is permanent and fixed in childhood or adolescence goes against everything we know about child development. So this bill needs careful scrutiny from both houses, plus extensive consultation and stakeholder engagement to ensure that it is developmentally informed and doesn't inadvertently make things worse for our young people. These children do need to be protected. And in part, this means allowing them to go through identity exploration without the influence of activists or politicians. And the professionals who might be the ones helping them, they need protecting too. So, to wrap up, how am I doing for time?
Good.
Yeah. So to wrap up, the CAS review is the longest and most comprehensive piece of work that's ever been conducted into gender identity. I am proud that our country, despite the hostile climate, has taken the time to think and attend to this group of vulnerable children and their needs. We are leading the world on this. NHS England has dedicated hundreds of thousands of hours, and no doubt pounds, to exploring the question of how best to help them. It is crucial then that Labour's conversion practices bill, however well intended, doesn't inadvertently undermine the implementation of the CAS review in full. Because the only way to really be an ally is through protecting children, their clinicians, and evidence-based practice itself. Thank you.